Good morning, Quad Cities. Great day in the Quad Cities as usual. And it's something that, we need to really get in there and be as healthy as we can, because the success of our city, the success of our economy, the success of our people, our families, etc., all depends on our health. I mean, you don't want to be a bother, of course. And in order not to be a bother in this world, you've got to be healthy. In order to be productive, you've got to be healthy. I speak to a lot of people around. I'm kind of an outgoing guy, kind of an extrovert. And so I get involved in a lot of conversations. And one of the things that happens in a lot of these conversations, as soon as they find out that I'm a chiropractor, they have goers go, "Oh, geez, my back right here. Can you help me with this?" And of course, I say, "Well, come into the office and we'll take a look at you and find out. I'll tell you whether, what I can do and what I can't do." But anyway, I get these conversations, and there's a continuing theme that is kind of interesting, and it kind of goes like this. They hold their back and they say, "Oh, well, you can't do anything about it anyway. It's just arthritis." And I say, "Well, why do you say I can't do anything about it because it's arthritis?" And they say, "Well, everybody knows that once you've got arthritis, and that means pain, and that means you can't do anything about it except take pain medication." And I, of course, kind of try to correct them, and we'll correct them a little bit more, but correct in that conception a little bit more during the radio show here. But it's kind of interesting, because that is exactly what gets people on the line toward not only over-the-counter pain medications, and most people think that's innocent, when we'll talk about that a little bit too, but it gets them on the hook for even more powerful pain medications, because these pains that they're talking about are not always just innocent. I mean, they're not just, "Oh my gosh, I've got a little pain when I first get up," and then it goes away within about 3 minutes. Or it's a low-level pain, and I can put up with it. And it says, no, some of these pains are excruciating, and they can't bend over, they can't do the things they love to do, they can't garden, they can't play golf, they can't do all these things. And it's serious pain. A pain that obstructs the things that make their life most meaningful. So this is not a trivial concern. And yet what happens is they throw out this, "Well, it's just arthritis," and then they stop looking for solutions for the function that they're being hindered from doing, and they start looking only for solutions for pain, as if pain is the root of the problem. And we're going to see very quickly that that's not the root of the problem. But first, this whole topic that we're talking about, what is it about the A word? This is what I call it, the A word, and that's the word for arthritis. And I name it that because it comes up so often in conversation. And the A word kind of blocks people's thinking. It prevents them from going any further. But my question usually is this. I say, "Well, when did this pain start coming about?" And they say, "Well, oh my God, it started about a month ago." And my question, of course, is, "Did you have arthritis a month ago?" They say, "Well, yeah, I guess I did." I said, "Did you have pain a month ago?" And I said, "Well, I guess I did." But I said, then the arthritis isn't necessarily what caused the pain, right? The arthritis has maybe been building and things like that. Maybe it reached a threshold. But what if we could get you back to what you were about a month ago? What would it be like then? And they say, "Well, I guess I wouldn't have any pain then." Yeah, okay. And that kind of brings up a very, very important point, and that is this, that the function of a joint, and joint, by the way, is exactly the root word for arthritis. Arthro in Latin means joint, and itis means inflammation. So if you've got a joint that is inflamed, then we've got to deal with the inflammation to some extent, and to do that, we have to deal with the function of the joint. Now, what are joints for? Well, there's only one reason to have a joint, and that is movement. In order to have movement, you have to have some kind of articulation, an articulation where you've got, a break between two hard bodies, and it's kind of hinged, and therefore it moves. You look at your finger and you bend your finger if you can do that. And those are all joints. There are 3 joints, and actually 4 joints if you count the knuckle. And those are all joints. That's arthro. Arthritis. If you got arthritis in there and there's inflammation, then that's arthritis. Okay, now, so arthritis is, not a good thing. It's actually, by the way, well, I can't say it's not a good thing, because if the body does it, the presupposition, or my presupposition, my assumption is that it's trying to do something good. And with arthritis, it is trying to do something good. Namely, that when you damage a joint, the body is going to try to heal the joint. If you damage it enough, maybe a little sliver of cartilage is separated from the bone, then the body starts to fill in extra bone in order to reattach that damaged cartilage. So is that a good thing? Well, absolutely. You've got to try at least to reattach that cartilage, and that's what osteoarthritis at least is. It's an attempt of the body to heal the joint. Now, does it alter the mechanics to some extent? Well, yes, it can. But the point is this, that if you can restore function to the joint, then you've got a chance at reducing the inflammation again. So let's talk a little bit about how to restore function to a joint. Okay, first of all, it's very, very important to understand what cartilage is and how it works, because the cartilage in your joints, that is on the end of every bone, and if you've ever eaten a chicken, you know that there's cartilage on the end of the bones, and the cartilage on the end of those bones is there as a kind of a slick bushing, if you would, to reduce friction in the joint and make it so you can use your hands all day without them heating up and things like that. And then the cartilage is lubricated by a liquid called synovial fluid. Now, the most interesting thing about cartilage, all the cells in the body, and cartilage is composed of living cells. All the cells in the body have a pretty close blood supply. There's capillaries running through the tissues, and that supplies the tissues with oxygen, with food, takes away waste products, and it removes carbon dioxide, okay? Then you breathe the oxygen back in, it's used, it becomes carbon dioxide, and then it's removed. And all this exchange of nutrients and oxygen is occurring all the time. And it's very fast exchange in almost all the other cells. They're mostly faster metabolic cells. But cartilage is not. Cartilage is just hanging out. Cartilage is a very slow metabolic cell, and it does not have any capillaries in it. Now, capillaries, of course, carry blood, and you wouldn't want capillaries in your cartilage. Why not? Well, if you had capillaries in there and you came down hard on your knee, which has, 3 layers of cartilage in it, if you came down hard on your knee, what would happen? It would damage the cartilage, and you'd have blood going into your knee all over the place, and you wouldn't want that. That's not a good way to be. So we don't want cartilage in our knees. So the question then is this: if blood carries oxygen, food carries away waste products, then how does the cartilage get its oxygen? How does the living cells in the cartilage actually remain healthy? Well, it turns out that the synovial fluid picks up oxygen and food from the sac that surrounds the joint and carries it into the cartilage. And the cartilage is moving on cartilage because it's always the same, every joint in the body. It's bone covered with cartilage cap covered with bone, the cartilage is together. And the cartilage, as it moves on cartilage, squeezes out the waste products and draws in the nutrition and the oxygen. So you put pressure on the joint, it squeezes the waste products out. You take the pressure off the joint, it draws in the nutrition. So when you have a good joint that is moving properly and the cartilage is pressing and decompressing on itself, then you've got good nutrition in the joint, and the joint has a tendency to stay really healthy. However, when you damage the joint, and when you damage particularly the ligament straps that hold that joint together, that hold those two joints in proximity, then what happens is you get a sloppy joint and you get motion that is out of range, so to speak. And you get alteration of mechanics that can actually cause the joint not to move properly, and so that it doesn't get this constant pushing the waste products out and drawing the good nutrition and the oxygen in, and then the joint starts to have a real challenge. Okay, so imagine a joint that is normally moves kind of high and on each other, and then it gets damaged, and now it drops into a kind of shelf. It drops off the cliff, so to speak. And now to get it over that cliff again, it takes a little extra force to get it over there, and then it moves on the nice surface again where it's supposed to move, but it tends to fall where? To the lowest gravity position. So it tends to fall off the cliff again and just kind of get locked in there. So that's because the straps that hold the joint together properly have been stretched or torn. And car accidents are famous for this in the neck. It's just incredible. And so now it's going to hang out below the cliff a little bit, and it's going to take extra force to get it back up on top of the cliff again. When that happens, then joints aren't moving properly, and without proper motion, you're not squeezing the waste products out and then drawing the nutrition back in, and the joint cartilage starts to get unhealthy. It starts to get sick. When that happens, then you're setting things up, or things are set up for special problems and start the development of arthritis, osteoarthritis in particular, because the joint now that is damaged and hanging out underneath the cliff there a little bit, can't quite get up on where it's supposed to be again, that joint is gasping for oxygen, starving for food, backing up with sewage, and being smothered by carbon dioxide, and the cartilage, after a while, starts to get sick. When things get sick in the body, what happens? You get inflammation. And what is inflammation? It's the attempt of the body and the immune system to heal the situation and get it back on course. But if the motion isn't correct, then in the joint, it's never going to have the right oxygen and things to do what it needs to do. Now, I'm just going to give you a little bit of a clue of where this is going, and then we're going to go to another commercial. But the clue is this, that you ask yourself, well, where does chiropractic fit into this? And the answer is, well, what do chiropractors do? Well, chiropractors find joints that aren't moving and they move them, right? And they move them back into their appropriate range of motion, back where they are exchanging nutrients. So one of the main things that chiropractors do is they take dysfunctional joints, joints that are not working properly, and they get them working better again. Hey, we're talking about conversations I have all the time with people where the A word comes up. The A word is the arthritis word, okay? Arthritis generally means a inflammation of the joint. But what happens is very often is people just give up when they hear the word arthritis, and they don't realize that joint function can be restored if you, as a matter of fact, understand how the joint functions. Now, unfortunately, and this was, oh my gosh, this was actually admitted in an article in the Bone and Joint Journal that I recently read this article in by John Hopkins University, one of the, 3 or 4 top medical schools in the entire country. And what they admitted in that article was astonishing. I'll bring it next time, hopefully, and read it to you. But the article admitted that in John Hopkins, for several decades, they have not had rounds for their medical doctors, their medical graduates. They have not had rounds in musculoskeletal conditions. For several decades, they haven't offered one elective or one requirement in musculoskeletal conditions. Now, if they aren't doing it, who else is not doing it? Because they are kind of like the archetype. They are the best example of the finest of medical training, the finest medical school in the country. And they are not having rounds in musculoskeletal. That means muscles and bones and joints and things like that. They don't have rounds in that. That's amazing. So when it comes to finding out who to go to in order to take you from this arthritis, which has sucked so many people into dangerous medications, living on over-the-counter medications, or even being sucked into the opiate crisis, and let's face it, I mean, if you knew that a doctor was giving you an opiate drug, something that is analogous to heroin, if you knew that, wouldn't you be hesitant to take it? I mean, isn't that something? Don't you kind of depend on your medical doctor to know what drugs are highly addictive and what drugs are not? If your medical doctor didn't know that they were giving you a highly and dangerously addictive drug, I mean, more than 100 people a day are dying of opiate addiction now in this country. And those are prescription numbers. That's not the actual heroin addict that's laying on the sidewalk injecting. These are people that are taking prescribed medications. If your doctor didn't know that they were giving you a highly addictive drug, can you trust their knowledge in other ways? Well, you have to really look at that carefully because, I mean, why are they giving it to you? Well, because they don't understand arthritis. They don't understand the pain, the source of the pain you're experiencing. Why? Because they don't offer them that education in medical school. Now you contrast that with somebody who's graduated from Palmer College or one of the other chiropractic colleges. That's all we do. Joints, yes. Musculoskeletal. In fact, we add neuromusculoskeletal because we focus on the spine. The spine is what houses the nerves that come from the brain and branch out to the rest of the body. That's what we do. And yet, most of the country still, for musculoskeletal conditions, goes to a medical doctor first. And medical doctors are not even trained to understand what we do as chiropractors. Now that's tragic. And the tragedy has been so compounded by the medical profession thinking that pain is the problem, not joint function, which they don't understand, but that pain is the problem. And so what do? Well, take over-the-counter medications. But if it's bad enough, come back and we'll give you an opioid drug. Does that sound smart? Why don't you start with saying, well, let's see if we can improve the function of the joint? Because a well-functioning joint or an improved functioning joint may get you back to that point a year ago or a month ago or 5 years ago where you didn't have the pain, right? You improve joint function, you improve the pain response almost automatically, it seems almost magically in some cases, because people come into my office with low back pain, neck pain. They've had it for years, and within a very short amount of time, within a month or two, they're pain-free, they're headache-free, they're low back pain-free. A lot of people, as a matter of fact, this always gets me because I go very carefully. Is there anything else, is there anything else that's bothering you, et cetera? And yet, 2 years later, I'll find out that a person has had foot pain for the last 10 years. And they've been patients for 3 years already, but they've had foot pain that they didn't mention it. Why not? Well, my doctor told me it was arthritis and there's nothing you can do. Well, we adjust their feet. Feet are amazing. We adjust them a couple times and they're pain-free. It's amazing. It really is amazing. Sometimes, by the way, it takes more than that, but mostly with feet it doesn't. It's incredible. So they come in a few times. We get the joints working well again. We get the relationships right. We were talking about how the things fall off, the joint falls off the cliff, so to speak, and gets into a position where it can't quite get where it's supposed to be. And we emphasize that what do chiropractors do? They take joints that aren't moving and they move them. Take joints that aren't moving properly and they get them back into the range of motion over time where they are moving properly. It gives the joint cartilage the oxygen, the food it needs. It takes away the waste products and the carbon dioxide away from the joint, gets the cartilage healthier again, and it gets the joint capsule or the sac around the joint moving in an appropriate range so it gets healthier again. And what happens? The pain goes away. Why? Well, it's no mystery. The joint's working again. It's not fighting against itself all the time. It's not bumping up against things, obstacles that have been created in the joint, etc. We do this all day long. Why? Because our education, and we have, just to get through Palmer, you have to have a minimum of 6 years of education past high school. Most people have 8 years past high school. We study human physiology with an emphasis on musculoskeletal and particularly neuromusculoskeletal relationships. And why do we do that? Well, for like 100 years, nobody else was doing it. And according to John Hopkins, nobody else is still doing, I said that wrong, is still not doing it. Okay? You got to set these sentences up so they work. Anyway, so they're still not doing it. And that is a tragedy. Then, by the way, this article was great because they were saying that, and we've got to fix this problem. We got to fix this problem. And I said, great. I'm glad they're at least on track. They're going to fix this problem. And so I started reading the curricular modifications that they had planned on doing. And it was just wonderful, except it didn't include taking joints that aren't working and improving their function. It didn't include that. What it was talking about is we need to do more surgery and we need to have better medications. I said, oh gosh, why don't we just work together as chiropractors and medical doctors, and you refer them to us. We'll get the joint working as well as it can, and if that doesn't work, then we can consider surgery and other options. But until then, we're going to work on improving joint function, and by improving joint function, we're going to put this thing back together again and get people out of pain, get them enjoying and loving their life again. That's the important thing, I think, that needs to happen in medical education. Okay, we have one caller. We're going to try to get it in real fast. It's not, oh, no. Okay, I guess we're going to skip that because we don't have enough time to sum up otherwise. So anyway, what happens is this. What I'd recommend is give us a call at the Welcome to Health Center, and we will be happy to evaluate your case, and we'll be happy to make sure that we get you the right care. And if we can't do it for you, if we can't help you with your arthritis and the pain associated with it, then we will be happy to get you to somebody who can help you with other issues. But until then, I would recommend that you take the conservative chiropractic care. You make sure that things are working well, that the joint motion is good, and that the cartilage health is starting to be restored. And I can tell you that that's the place to start with pain. Headaches, neck pain, low back pain, foot pain, hand arthritis. You may have swollen joints. We do a good job with that too. And we are the musculoskeletally trained doctors in the United States. Call the Welcome to Health Center. Hope to see you soon. Bye-bye.